Welcome to Unmasking Social, where we talk about building real friendships and meaningful connections without masking who we truly are. I'm your host, Sharon Baum, a speech and language pathologist with an expertise in social thinking and how it relates to autism and ADHD, specifically with our teens and tweens. Let's dive in. Today, we are going to be hearing about a very important topic, auditory processing disorder. So many of our students end up in such difficult situations, and that is no different for our individuals struggling with auditory processing disorders who, in some cases, end up incarcerated due to starting off with not understanding those subtle cues because of processing difficulties. On today's podcast, Dr. Rae Stout breaks down what this auditory processing disorder really looks like and how it interferes and interacts with the autism or the AuDHD, which is combined autism and ADHD, so that we better understand how we can let our individuals process information when it is not naturally processed by their brain systems. Welcome back to Unmasking Social. Today we have an audiologist, finally, who has done such great work in the field, not just in audiology, but with auditory processing disorder specifically, as well as misphonia, hyperacusis. Dr. Rae, I don't know if I'm saying that right, and all the things that one can think of. Dr. Rae and I actually met recently on social media about a few months ago because she's not just an audiologist with 25 years of experience, but she's also started international support groups for children and their families who are autistic but may also have ADHD. And she has lived through this experience herself, and her children are also living through some of this. So I'm just so glad to have you, Dr. Rae, on this podcast. Thank you for being here on this Friday, summer day, spending it with me.
I totally appreciate your having me. We could be at the pool grilling lamb chops, which is my special interest, but I think we can wait a little longer.
Yeah, but after this, maybe. I expect an invite. But thank you so much for being here. One of the things that really was eye-opening to me was when you had found me on social media a few months ago and said, let's get on the phone. And I said, who is this person? What do they want? But you said we should get on the phone and discuss your expertise. So I said, okay. And I just mentioned that I was a speech and language pathologist. And you said, yeah, well, I'm looking to build a bank of professionals who are reputable because part of your advocacy work seems to be to support our teens, our tweens, our children, our young adults, and beyond that, because it seems like the process of getting a provider, whether it be a speech and language pathologist or a neuropsychologist, is not that easy if you want to find someone who is going to work with you. I know you've had different experiences with that. So can you tell me more about that advocacy piece and how you're trying to build bridges with professionals all across the board?
One of the main things I think about is how siloed the different specialties tend to be. And I grew up signing, so forgive me, I use my hands. But
me too. I don't even sign, but I just go like this. I grew up in Brooklyn. I don't know. My hands are always going.
You have the pathology group, you have the audiologists, you have educators, you have the dyslexia people, you have the psychologists, you have the OT, and each one of them have blinders. And they're not willing typically to consider outside their own field because they don't want to take the time to learn what's outside their own fields, or because they're just more comfortable with the routine of what they already know and what they already do. You ever been in a trust fall before? You go to camp and you stand on the edge of the stairs or on the edge of a picnic table, and there's a whole group of people that hold their arms out and they interweave their arms with each other, and you're supposed to fall onto that.
Oh, yes. Oh, we did that. I remember even in high school, and I remember being really scared. I don't know if I have trust issues. So scary.
I kind of believe that as providers, we need to be able to interlink our different areas of specialty in such a way that we provide a scaffolding or a bridge that's safe for people to rely on. And that's almost a grand rounds kind of situation. Like you go to med school, and the way you learn in med school is you have all these professors and teachers who teach around the patient. But my issue with that is so much of it is looking down on the patient. The patient isn't an expert in their own lived experience. So in my version of this trust fall, the patient is one of the hands catching the patient.
Oh, okay. So the patient is catching themselves because everybody's working not together, And that can create a lot of difficulty because the patient's looking for different people and they need a team of people.
Exactly like that. What I'm saying is all the people that are catching the patient is one of their own team members catching themselves. They are an expert in their own lived experience and they're treated as an equal instead of as a subordinate.
And so you think that oftentimes they're treated as subordinates?
Oh, yeah. They act as if people have Munchausen syndrome. You can't possibly know what your lived experience is, particularly in situations like Ehlers-Danlos syndrome. And people say, I'm having all these issues with my hands are going numb and my back keeps going out and all these things are happening to me. And the doctor says it must be female anxiety or something. People don't trust people's actual or the parents' actual lived experience. And instead, what ends up happening is they're passed from professional to professional without any actual support.
And you've seen this a lot.
This collaboration.
It's so interesting that you say that because I've worked as a speech and language pathologist primarily in the schools. And I found that very often it was very hard to collaborate because we were siloed a little bit, or we felt a little like we were the related services. And so when you're a related service, right, a lot of times it kind of causes people not to be collaborative. But the program I worked in, the NEST program for individuals with autism, forced us to be collaborative, and it was great. But in general, in the education system, I found that. So it's interesting that you're mentioning something that goes beyond the education system. Even in your work in private practice, you find that everybody's operating separately. I did not know that.
Everybody's working in their own little room, and a patient comes to me and I don't really know anything about this patient except for maybe a few lines from our intake person. And maybe I might have a report and I might not know how to read the report. Like potentially it could have psycho background and I'm not sure what to do with what I'm reading. So I don't really fully understand. I can do a really in-depth case history, but wouldn't it have been better if there had been 4 or 5 or 10 people who've all encountered the same person and the person themselves got together in a room and had a discussion about what they needed so that they didn't get too many services from one person and too few from another?
Yeah, that would be amazing. And I think that's what you're trying to build. I mean, amongst so many of the other things that you're doing.
What I was trying to do is I was trying to figure out just by interviewing professionals, which professionals were open to neurodivergence, which professionals were really open to disability, and which professionals, like a speech pathologist I ran into recently, who just didn't get it. Like I brought her into a conversation group. She tried to treat a patient with Tourette syndrome and misophonia in front of everyone else without permission.
With ABA? Oh.
And I saw it with applied behavioral prompts. You're doing this when you feel triggered. How long does it take before you start feeling upset? And I'm like, you're treating her as a list of labels as opposed to a whole person, and you're doing it publicly. How dare you?
Yeah, I mean, that is so awful. Like, I'm just thinking about how this person probably felt.
No, it was bad enough. I actually ended up having to write an apology letter to the misophonia Facebook group to try to find that person, apologize to her, and let her know that I was not allowing that person back or that type of behavior. It just was not okay. I don't care if somebody neurotypical and speech pathology really thinks that it's appropriate to treat people publicly without permission, but I'm not okay with it.
I mean, Dr. Rae, that really hurt my heart. And for people who are listening, they're going to be upset by this as well. But I'm so glad that you shared that, because I think anybody who's listening can use it as a teachable moment of how we have to always listen to the individual who has autism or Tourette's or whatever it may be. We want to listen to them and hear from them about what works for them and what doesn't.
I think what was really interesting was all the other people in this conversation group were all autistic or ADHD like me. And we have a different type of interaction because that whole issue that we have a tendency of having certain experiences of being gate-kept and the wool pulled over our eyes because we didn't necessarily grow up knowing how to interact in the neurotypical society, but we understand each other very well. And we were in that room, every one of the people, their jaw just dropped. Like, I can't believe that woman did that. And the speech pathologist, I said, I hate to tell you this, but listen, you really embarrassed yourself socially. And this is what exactly you shouldn't have done. And this is why. And it's like she'd never had the experience that she's enforced on everyone around her before of telling everyone you have a teachable, she had actually come to me about a week before and said, I really would like to critique your social interaction during the group. And then she ghosted me for a week after telling me I made a mistake. Okay. So I spent the whole entire week worrying what I had done wrong because I've spent most of my life with that feeling of I'm not fitting in, I'm not interacting right. And she didn't even think about the fact that she said to me, I'll talk to you on Wednesday and I'll let you know what I was thinking. Instead, she just disappeared and then showed up again just to promote her own business.
Yeah, you must come across some really wonderful people, but at the same time, you're also coming across people who maybe don't have the best interest of the individuals they're working with all the time. You get to see all the different people.
We met some really good people. I mean, one of the issues I was having on these interviews was I felt like I definitely met some good people that I got a good feeling from. Many of them were neurodivergent, so I really understood them. But I didn't have reviews on them. I didn't have testimonials. So I only had what they said they were good at. So that's why I started the Neurodivergent and Disabled Yellow Pages group.
On Facebook.
It's a review group. So people that actually write reviews of serving the community. Because I love the idea of collecting these professionals, but I can't base everything just off my gut feeling, because what if I'm wrong?
Right. I think that's really key, is that you may think somebody's good for somebody, but it's the people that they're working with, the people who know them, that can actually give greater, like more knowledgeable, more informed reviews. So your idea is great. And it sounds like also you probably get triggered sometimes, because you had mentioned that the way you and the other people communicate to neurotypicals is going to be different because of your background. And you said that some of these moments take you back to when you just weren't fitting in and the neurotypical individuals were not understanding you. Can you take us back? I do this a lot to people. I take them back to their middle school years, which most people don't love. But can you take us back to those teen and tween years, or even earlier, when you first noticed that maybe something was different in the way that you understood social and how people reacted to how you were processing information in the social world?
Well, it's interesting because I broke up with a friend recently, and it brought me right back to that feeling. I grew up, I have some auditory processing issues, not to a level of disability, I'd say, but to a level of fatigue. Okay. So if you test me, I'll show up normal sometimes, and sometimes but my areas where I'm strong, I'm really strong. But my areas where I'm weak, I'm kind of low average, right? So I hate learning through auditory and listening to teachers and sitting on chairs where I'm uncomfortable. And when I was in school, about 10% or so of the kids I went to school with were signers. I'm starting when I was about 3. And I quickly gravitated towards the signers because I found their social mores, their rules. The rules were more straightforward than the typical neurotypical situation. Like the mainstream was much harder. There was more variation between the different people's interpretation of social rules. But in the deaf community, it was much more black and white, which was easier. And I would gravitate towards that group because it was easier and I preferred the language. And I became fluent quickly.
So that's how you're fluent in sign language now. Oh, wow.
I started when I was 3, but I became fluent in fluent. And I was interpreter certified, but I'm a terrible interpreter because I don't listen very well when it's noisy. Although I was certified, it's still a bad idea. But my point is, I was bullied by the deaf community over and over and over the years because I was never deaf enough. I mean, I was bullied from the neurotypical society because I wasn't neurotypical enough. Then I got into the deaf community and I wasn't deaf enough. So I was basically shunned out of both groups, but less so the deaf. They'd let me be a hanger-on because I could be useful.
Wow.
And it was just a constant third wheel. I was always on the outside looking in, and I never was accepted for who I was. So when I recently had this argument with a friend who started a nonprofit that I funded, I wasn't deaf enough for that group. And when I made a forwarded an email from one email address to another so I wouldn't lose it, I was accused of betraying the nonprofit because I had a memory issue. And then they publicly shamed me because I got upset that I was accused of being a traitor for having forwarded an email because they're stupid social rules in this nonprofit were like yay and nay and follow this rule and follow that rule. And I was like,
and that doesn't work for individuals.
It was for disabled individuals, but I wasn't deaf enough for it. So I ended up going back and writing a blog about what it's like to not be deaf enough when ASL is your preferred language.
It's so fascinating because when you first started telling the story, it reminds me of a lot of times on this podcast. Very often, I want to support the teens and tweens that I've worked with for so long, and your children are going to become teens and tweens. Not yet. I mean, your son already is going to have the bar mitzvah, the traditional turning 13 rite of passage. He's becoming a man.
We're going to delay him probably till 15 because he's gifted, but he's also AuDHD and sort of PDA like me.
Yeah.
And I don't want to force him through it when he doesn't want to do it. I want it to be a labor of love, not a resentment.
I noticed that you started posting about your children a lot, and it comes full circle to how you can go back in time and you can detail what happened to you as a child, and you want something different for your children. You want to really accommodate their needs because you're seeing that the world is not going to always accommodate them. So you'll delay the bar mitzvah. You'll make the accommodations because the world won't necessarily delay them or accept the differences or accommodate. So I love that you're doing that for your kids.
It needs to be understood and transparent and consensual. But we're doing a lot of things to try to help them. We do a consensual token economy with them to keep the behaviors in better shape and keep the house from being chaotic and to get them motivated to actually do schoolwork and stuff. And we pay them up to $100 a week. It's like, okay, here's your maximum of $400 a month you might be able to earn. But if you don't keep your room clean on the Sunday and have your laundry done, your entire bank account, it's gone.
Right. Well, at this age, they're incentivized by money. So most people that age.
No, they absolutely are. And they choose to be involved. This is not ABA. This is a situation of they choose every week if they want to be involved the next week.
Yeah. Well, I love how you're giving them ownership of that, of their own tasks, and say, hey, if you want to take ownership, you can. If you don't, you won't make the money. But if you do, you will. And you're picking something that incentivizes them. And that was all what we did in our program collaboratively, is that in order to motivate someone socially, you have to pick something that they like, that they're interested in. It's not always money.
And they get incentivized on like art. They get incentivized on reading. They can get points for all sorts of things, exercise, but they help use all the values and stuff. But similarly with the bar mitzvah, my son, he's not ready. He's not ready to go through that type of a ritual. He's barely writing a paragraph at a time. And to have to give a speech in front of a group of kids, he doesn't want the big party. He's like me. My father's wedding is this Sunday.
Oh, mazel tov. Congratulations.
And I'm going to be hiding in the bathroom for at least 3/4 of the ceremony after they get married. As soon as the reception starts, I'm in the bathroom, hiding.
Is that because of the loud noise and the sensitivity and the sensory stimuli? Too much coming, right? Well, we're going to touch upon that because as someone who is sensitive to stimuli coming your way, you're a specialist in auditory processing, and you're also an audiologist, which kind of ties back to being part of that deaf community. So when you first started speaking about it, it really brought me back to other podcasts where I put everybody on the spot usually and just say, like, what advice would you give to our teens and tweens, right, that are on a daily basis feel like they're not fitting in? It's a hard time for everybody, but they feel like they're on the outside looking in, like you mentioned, and people are trying to understand their social nuances, but don't always understand because they're not trained to understand and things are not neuroaffirming. If you go back in time to when you were trying to be part of the deaf community, I feel like you were doing something really powerful, which was finding your tribe. You were trying to find a tribe, and that was the tribe, right, that you were trying to find. But then even that tribe didn't fully accept you. And so it's so fascinating how you were actually doing that thing, which is getting that group, trying to get that group in place, which so many people on the podcast episode say, find your tribe. It's just in your situation, it didn't fully work. So was there something that changed or shifted in your mindset when you started noticing, hey, this isn't really working. I'm not deaf enough. I'm not neurotypical enough. Did that lead you towards something else in terms of finding for those that are struggling to find others who can understand them?
I think it's an ongoing evolution. Honestly, I go in and out of feeling like I fit in. I absolutely have friends at this point. Not all of them are neurodivergent, but most of them are neurodivergent enough that they're able to keep up with me in terms of intelligence, and they have their own little quirks. And sometimes we chafe, and sometimes, most of the time, we don't, because if they chafe too much, we don't keep as friends. I think the main thing is saying, you know, the song Dainu
From Passover? Yeah.
Remember what it's about?
It's about even if God wouldn't have done certain things, it's enough. Like, for example, if I should remember from my Jewish school days, but so for example, he didn't have to take us out of Egypt, which is kind of the whole story of Passover, which is we got freedom, we got liberation from getting out of Egypt. But even if he didn't do even small things, that would have been enough.
It would have
even
been
the
enough.
small things were enough.
And I think what I've gotten to the point of saying, I am enough. And I don't have to keep searching, that the right people will find me. And if I put myself out there and I write enough blogs and I do enough good, those people will be attracted to me and I don't have to go searching for them.
It's so interesting. And I know you're getting so emotional. I wish I could give you a cyber hug. But people are finding you. I mean, I found you, you found me, then I found you, we found each other. But so many people are reaching out to you, I see, because you're sharing, you're being vulnerable, you're opening up your heart.
Hatred shows up too. But I have to just say, Dainu, you know what? I don't have to take the negative in. I don't have to take the negative messaging just because I'm a disruptive influence in audiology. Of course, it's going to chafe against some people.
Yeah, I mean, very positive. I mean, you're so emotional because you're so vulnerable. You really share, and you do that on social media too. And I think people can see how honest and open you are, which a lot of people are not fully honest, and you are. And when people see that, they feel like, oh my gosh, I'm experiencing that too. And this person's being real about it. Like, you're being real about the children, you're being real about the experience. And at the same time, you're holding it close and being grateful for what you have, even when things are tough. And being grateful is probably the biggest thing I feel for all of us, is to reach that level of gratitude and say, we're enough, what we have is enough. But it is really hard sometimes, especially in the world that we're living in, where people don't accept us for who we are. And like you said, the right people will find you, and they are finding you. And it's interesting because you are also such a big change maker, and no change maker can actually not cause this disruption, right? I feel like in general, if you want change to happen, you will have to be disruptive. If you're going to sit and not do much about you're going to just accept the status quo and not do much about it, yeah, you won't be disrupted. So with that comes, unfortunately, a lot of, I've seen resistance, right? From the non-neuroaffirming world, which is, wait, why are you changing this, right? Where are you coming from?
Everything's working fine. Everything's not working fine.
No.
And kids are falling through, and adults are falling through cracks, and people are getting gate kept by my profession and the surrounding allied professions. It is not okay what is happening. There needs to be a revolution.
So when you say that people are being gate kept even more right now, do you feel like there's been a shift?
We're definitely seeing changes in the current political environment that are discriminatory against people with disabilities. People are not getting sign language interpreters. They're just getting iPads. People with autism are getting listed on registries. There's all sorts of things that are happening right now that are not good. And I think if our professions aren't supporting people with neurodivergence, they should be replaced.
Yeah, I mean, I just think about my field and all the people I know, and everybody's so supportive that I know, maybe because like attracts like, but of neurodivergence, it's shocking to me that it's not. And I guess maybe because that's an area I specialized in. So I don't know, maybe the dark side, I haven't really gone deep into things, but it seems like there's still a lot of people that are caring, and you're one of them. And what's so fascinating is I'd love to touch upon your experience with auditory processing disorder and how this intersects and really does impact individuals with autism or AuDHD. It's something that you have lived through in terms of having maybe all of them combined. And I feel like to this day, people really misunderstand auditory processing disorder. When I was working with the teens and tweens for many years and still do, I feel like auditory processing is something that people say, but they don't really understand. Can you kind of help people understand what auditory processing disorder really is and how it really impacts individuals that are neurodivergent? It impacts everybody, but especially those, and can maybe look a little different and maybe look like the person doesn't want to interact when really they just aren't processing information because of the extreme overwhelm.
So auditory processing disorder, there's a lot of about auditory processing disorder that's not necessarily worth getting into, having to do with the issues with testing. There's some massive issues with identifying it through testing, but if you ignore that and you just look at case history of what you typically see with somebody with auditory processing issues like delayed response time, missing directions, poor phonology, spelling or reading, difficulty in background noise, difficulty with prosody or pitch. Often there's musicality, but they don't really follow like questions, sarcasm, so forth. So they miss social cues. There's about 40 to 70% overlap of issues with auditory processing within autism. Not sure how much it is with ADHD, because personally, I believe ADHD is on the edge of autism, but there's that overlap. Obsessive compulsive issues. There's overlap with misophonia, which is the dislike of like soft personal sounds usually. And there's overlap with hyperacusis. And dyslexia is huge, is close to 70%, with the exception of the few dyslexics that have visual processing issues. And sometimes they have both. I talk quite a lot about how difficulties with auditory processing can lead to massive downstream problems. So if you imagine that the snowpack on a mountain that becomes a stream, that becomes a river, and the river heads downstream and eventually hits the delta and goes into the sea. Yeah? And that river is the flow of language over time. Okay. It's the learning, the cognitive development, especially related to language as time goes on. And it isn't just language. It affects proprioception. It affects balance and vestibular. It affects cognitive access to theory of mind, to social skills, many other things, even eye gaze, but primarily language. Okay.
Mm-hmm.
Auditory processing disorder is not the cause of these other issues, but it's the first bottleneck. The cause is probably epigenetic or genetic. It could be nutrition. It could be something having to do with sleep hygiene, even like Ehlers-Danlos for the constant fluctuation of the collagen issues, where you can have differences where the eustachian tube connecting the middle ear to the throat and letting the middle ear clear out in pressure. It can cause fluctuating hearing losses, and it can cause negative pressure in the middle ear. It can cause ear infections, which there's a bill in Congress. It's been going since 2014 in Louisiana from David Cassidy, which shows the direct pipeline between ear infections and incarceration as adults. Because if you can't hear, and especially if it's uneven, okay, you can't tell where sounds come from in space. When you can't tell where sounds come from in space, your body's off.
Yeah.
Your proprioception's off. Your balance is off. On top of that, you can't tell if something's going to startle you, where it is. You can't hear in background noise. You can't hear phonics clearly.
Right.
Then you make mistakes with because the difference is in the vowels. So these kids who have these issues develop all sorts of downstream symptoms. Okay. So the bottleneck is, can they process? Are we going to come in and fix the processing piece, or at least the signal leading to the processing piece, before it becomes a rapid going downstream? Imagine that you have a kid who isn't hearing consistently. They can't tell where sounds are coming from his face. They're not picking up phonics and whatever. They develop dyslexia and articulatory issues. And people keep saying, he's 4. I'm sure it's just he's a boy. Just wait and see, wait and see. And finally it's caught by the teachers and the speech pathologists. It's sort of like having a flood and picking the branches off the bank and the debris. And then the speech people say, oh, this is the problem. No, it's not. This is the fallout from the problem. And the auditory processing wasn't really the problem either. It just was the first bottleneck. That if we had caught it here, we wouldn't have had them turn dyslexic. We wouldn't have had them with auditory problems. We wouldn't have had them developing OCD or misophonia out of fear that they couldn't tell what was in their environment, and they became hypervigilant. And they wouldn't have ended up poor, illiterate, and in prison.
Wow. So this is very serious. And I think that there's still a lack of understanding around this and how it further compounds.
There's other variables, obviously, but this is one of the primary ones. If a kid doesn't have access to language, they can't learn social skills and they can't learn from other people. If they're low language, they are handicapped for life.
So when APD meets autism or AuDHD, it's really a recipe for a storm of some sort, because somebody who's, let's say, 12 or 13 and was never diagnosed with APD, has autism, and maybe has ADHD, and then on top of it has APD, this is like the perfect storm for someone to really be struggling immensely. So it sounds like there's maybe not enough collaboration with audiologists on a lot of these things.
Autism is basically when multiple sensory systems are not processing information well. It's a sensory processing disorder that hits multiple senses and causes fallout.
Right.
Above APD. ADHD, but also when you have auditory processing issues, you can see symptoms that you think are autistic, but might not be. Kids that are overwhelmed and hypervigilant, they can stim to calm down and might not be autistic.
Right.
They might not make eye contact because they're watching your mouth and they're not autistic. They might show oppositional defiance or PDA, pathological demand avoidance, because of being worried about getting overwhelmed and they need to control conversations, and might even be violent because they're overwhelmed and their resources are flowing over. They don't have enough. But autism is upstream of ADHD, the same thing. If you miss bits and pieces of the information, of course you're distracted. You can't remember what you heard. I'm not saying all ADHD is caused by APD. What I'm saying is there are kids who are actually ADHD, and they're going to have issues with maintaining attention in a consistent way over multiple venues of senses, okay? They're going to still have problems visually. They're going to still have problems proprioceptively. They're going to still have problems auditorily. But if it's only auditorily, it's APD.
Okay, if it's only auditorily. And so people sometimes are given diagnoses that are not accurate. So someone may have APD and then they're given an autism diagnosis in some cases.
What if APD and a tactile processing problem?
Right.
How do you know what thing it is if they're getting distracted by an itchy tag so they can't remember something? How do you know that the issue is coming from this combination of auditory and tactile, or whether it's actually something else? Maybe it wasn't lack of attention at all. It was just a sensory overload.
Yeah, and I know that you speak to
That you have to fix the signal. You have to get noise out of the signal and amplify the signal so the speech or whatever they need to pay attention to is above whatever noise and sensory overwhelm this kid is dealing with before you go trying to fix behavior.
So we spoke about this on a little bit on a prior phone call where I asked you, why is it so challenging these days to know if someone is having an auditory processing disorder? And you had mentioned something about how some of the testing just doesn't allow itself to really provide this differentiated diagnosis.
The testing's crap. I mean, Wilson and Arnott, 2013, showed if you took 9 of the most common auditory processing tests, grouped it into groups of 2, you could see anywhere from 7.3 to 96% of the kids they test get identified as APD. So because of the testing being so not good, and it's based off of lesion testing in adults like veterans who get shot in the head or noise blasted or something. And then what happens is people take a look at those veterans and then they see kids with similar symptoms and they say, oh, look, it's a similar symptom. It must be the same reason. There must be a lesion in the same spot. Not necessarily. Look at a river with rapids. You can have the same wave caused by 5 different things. Don't know. Case history is actually stronger than any of the tests because it doesn't really matter what the cause is unless you can address the cause. If you can address the cause, address it. But generally with children, it's not because they got shot. It's not because they had a stroke. It's not because there's a lesion, but we treat it like there is. And then we look at the test and we say, oh, we should use this test designed for adults that we've retrofitted for children and hope it works.
No. Oh, I didn't know that. So it's basically the same test that you would use for adults, and then you're trying to make it fit, and it's not really fitting. And so a lot of people miss it even in your field, which is the field that usually gives that diagnosis.
Most of the tests haven't been changed since the 50s or 60s. A few of them a little later, but there's a whole contingent of audiologists that are gatekeeping this because it's their way of making money.
Yeah, I think that's most fields now. Yeah.
I'm saying I'm not using the test. What I'm saying is I'm transparent with the patients and the parents about what it tests, what it doesn't test, what we can add to it to increase at least qualitative accuracy. It may not be accurate to look really at the normative values, which we know. In fact, Matt Barker, the head of Acoustic Pioneer, put out a letter about 5 years ago or so. I don't know, may not have been, but it was a couple years at least, which said we're losing kids because our standards are too high on the standard deviations.
Mm-hmm.
Kids who should be treated but aren't. So, for example, I'm treating a 3-year-old right now who is obviously too young to be tested at age 7 for auditory processing disorder, which is total BS. I mean, why would you wait till 7? Just wait until they have problems. Just wait. And then they can go to speech therapy for the next 10 years. I mean, I should try to save your job here by making sure there's more kids. But
no,
if
we don't want that. We don't want late detection. Early detection is key for all these individuals, especially with this.
I would hope so, but I don't believe so. I think people are scared about losing jobs and they want to use the test they've always used and they want to keep it to the age that's the easiest to identify based on the norms because they are following the rule. But the reality is, I shouldn't fit a 3-year-old, right? This kid was so behind. This kid, I mean, yeah, we should wait and see till she's 7. Let's wait and see what happens. Almost no language, okay? Couldn't follow directions. She has Ehlers-Danlos, runs in the family. Mother is an occupational therapist, okay? She couldn't do anything. She couldn't count. She couldn't identify shapes. She's so behind. And also would like flip out from the sound of those foil balloons, like phobic, okay? Or the sound of air mattresses. And the mom reached out to me and she says, listen, Dr. Rae, I fit my kid with the help of a friend of mine who's a speech pathologist. We fit her with an over-the-counter piece of junk amplifier. And she had a language explosion within 2 days. I've never seen anything like it. I treat these kinds of kids. I don't know what to do. This is my 4th or 5th kid.
Wow.
And I don't know what to do. I can't keep her in this amplifier. It could damage her hearing for life. I'm not willing to do that. She could get tinnitus and hyper. I cannot do it, but I don't feel bad for having done it because now I know we have to do low gain hearing aids. And I'm the pioneer of low gain hearing aids. So she came to me and we talked for a while. I just talked to her today. It's 2 weeks in. Kids' language has doubled.
Wow.
She's 5 by herself, counting to 10 with help, identifying colors and numbers and shapes. She's tolerating the balloons and the air going into the air mattress. She was falling down the stairs because of proprioception issues. Not happening anymore. She's actually trying stuff physically that she wouldn't have done. The mom's an OT. She's keeping video, notes, everything, because she works with primarily neurodivergent autistic PDA. And this kid won't end up with a disability. What if we got these kids earlier? I'm not saying I need to sell them hearing aids. I'm saying, why don't we temporarily fit them until these fluctuating losses go away? How many fewer kids would be in prison? Because a whole half of them have reading disability.
And it's interesting. Do you have pushback from parents about this? Because I know parents who don't want their kid to have a hearing aid unless it's 100% sure that they have some sort of problem that is impacting their hearing or their processing.
They don't know. By the time they come to me, they've gone through trial of fire to find me. So look, they can try it. Have 6 or 8 weeks, see if it makes a difference. If it doesn't bother, send it. I mean, the only way you're going to know is by trying it. There's nothing I can predetermine. It's going to work. It's not going to work. And they're almost invisible.
Yeah, no, that's wild. I mean, those low gain hearing aids that you're referring to, that is not a classic hearing aid. Those are specific types of hearing aids specifically, right?
No, they're traditional. And you're programming on. And I started in 2013. Who knows? There's AI estimates there might be 600 people doing it. My guess is more like 120 around the country. I've worked with people, clinicians in Australia to train them. I've worked with clinicians in South Africa, in Canada, in the US.
Wow, you're global, Dr. Rae. You've hit a lot of countries.
Bad programming. They make up their way of programming if I don't go to them and say, hey, this is what my averages of over 3,000 kids has shown. Don't do it that way. Don't fake a hearing loss and then measure at the eardrum when you have a kid with a fluctuating hearing loss. What are you thinking?
Yeah. And it's so interesting because over the years, I have seen early detection in some cases because FM units are introduced to individuals sometimes, even in preschool, when there is a diagnosis of auditory processing. So it's never too early. But FM units, yeah.
Terrible by themselves because they can give up to 15 decibels of power, and then the kid is tethered to the teacher, unable to have any control or self-advocacy. And with the hearing aids, you can customize the FM signal to their preference. What happens if you have a kid with super pain from background noise and hyperacusis, right? And you put an FM on them, that's going to cause them discomfort and fear. I understand. FM systems are easier to research because they take no effort and no capabilities to fit. You just stick it in their ear and it works. You throw out the tube and put on another tube, but the sound quality is not as good because it's going through tubing, not through a speaker. Because would you want to listen through a garden hose?
Right. No, this sounds actually painful. Yeah.
Like the teacher goes to the bathroom and you might hear them talk about you from the bathroom or the hall. They're talking to the kids down in another area of the room and you can't hear the kid next to you and you have no ability to turn it on and off. It's like being shackled.
Yeah. Wow. So it's interesting because that still is a go-to thing that people do use. And the hearing aid is, I haven't seen it be used as much.
FM is not bad, but it's better when it goes through the hearing aids where the kids then have control and it's customized and it's less than 15 decibels.
Yeah, because what you mentioned is it should be common sense because if you think about it, if someone's so overwhelmed by external stimuli and then you're inputting something into their system that's giving them external stimuli through the FM unit or amplifying external stimuli, making it louder, then I can only imagine that that could cause some sort of pain, right?
All over it. So that control can exacerbate misophonia, hyperacusis, and OCD.
So I have a couple of questions about this. So as it pertains to APD, I feel like just like other areas of neurodivergence, it's just so stereotyped. And people just say about kids who aren't listening, they can't listen, right? And then that's one of them. And then you find out they have auditory processing or they don't want to participate. They don't want to engage. And then you find out, well, there's a processing disorder. What are people not getting?
I think people need to do a demonstration with a distortion hearing aid to get an experience on their own of what it would be like to not hear. People don't get it. Imagine taking a pair of glasses and covering them with soap like Dawn and to drive. I want you to walk around for the whole day with fogged up glasses or goggles. See how you do with that. See how tired you are by the end of the day. It's the same kind of experience.
Yeah. Wow. That's intense. And so people are still learning. It sounds like the learning curve for auditory processing disorder is still very large. A lot of people don't even know that dyslexia and auditory processing are so co-occurring. It's sad, but I mean, every individual that I've met with auditory processing has some sort of phonological processing issue as well. And people still don't understand the connection between the two. So there's a lot more that needs to be done. And then as it pertains to autism, in your opinion, and ADHD or the co-occurrence of all of this, how do you think that individuals can really work through all of this together as someone who lived this experience?
Say that question one more time.
Sure. As somebody who lived this experience, right, and had this co-occurring APD, even though it looked like you were good, you weren't, right? You had the processing, even to this day, it's a very overwhelming. Then with the AuDHD on top of it, right? What advice would you give to the teens and tweens now that are dealing with this, or the young children that are trying to navigate this with their families, but everything seems so overwhelming? Do they have to tease apart each diagnosis? Can all be worked on at the same time?
Well, you find a lot of when you deal, it's like a water balloon that's too full of water, okay? You can only add in so much stress, right? So you need to do things that make your life easier. For example, I work from a tennis club, like a country club, instead of working from home. And I do that because they have food they make for me and I can wear my comfortable clothing and I can have a fake background and I can walk on the track and I can go to the hot tub and they basically take care of me all day. And then it's always clean. And then
That's
I come,
great.
it's great. But I don't wear shirts that have tags. I don't eat food that disagrees with me. I don't do things that I find overwhelming and I go out of my way to get enough sleep. All of those things matter. But one of the things I'd say that's very important is people need to stop demonizing people's need to have an escape. It is okay to use headphones. I'm not a big fan of sitting in silence with headphones because you can get hypervigilant about what you're hearing. You can start hallucinating triggers. But you should have the ability at any time to do what I'm doing at the wedding and say, forget this, I'm going in the bathroom. I have the right to take care of myself. They say, give yourself air before you give air to your kid. It's the same thing. Kids need self-advocacy, they need control, and they need to be told they're not broken because they're not. Most kids are brighter than most. They have more connections, not less. They're just more sensitive. But you have to respect the sensitivity. When you do that, you start seeing things like the 3-year-old not falling down the stairs. You see kids who were picky with their food suddenly willing to try new things because they have capacity for change, more capacity to move away from the things that they were hyper-focused on.
I think I saw a post about how you found this tennis area and you actually take clients over there remotely. Like there's an area there that's quiet or more quiet, but something about it just kind of feeds your system. And you kind of learned what feeds your system through your own advocacy for yourself.
I like being social, but I don't necessarily want to be in an active, constant communication. And I like that I can find a quiet spot. And I like that my food is made for me. And I like that there's a hot pool. And I like that I can sit on a comfortable chair and nobody bothers me.
This sounds great. I think I want to try this, just like a spa treatment every day kind of thing. And then it's more relaxing. The anxiety isn't there from all of this. You feel less overwhelmed from all of the things going on. But I guess what you're really pointing to is that everybody who's listening needs to self-advocate for the things that work. If there are certain things that work for you, the world isn't going to necessarily come and accommodate, even though we have come far. We're not at that point yet where the world's going to just tell you, we're going to go make it easier for you. You have to find what's easier for you. For example, you don't wear the tags, right? Because you know that that's going to trigger you. You go to the tennis area because that's social, but not too social, right? There's a capacity there. And it's still something that helps you with your work in terms of focusing and attention. So it sounds like people have to learn how to advocate.
Self-advocate. I had a 3-year-old. This was 5 years ago. These were 3-quarter twins. The mothers were sisters, or they are. And they got pregnant at the same time by a paid-for sperm donor. And they're like almost twins, right? Not quite. And I got one of them at age 3 and the other one at age 5. And the 3-year-old was growing up using ASL and the 5-year-old was not. I'm making that wrong. They were both 3 at the same time. They were within like a couple days of each other. I just saw one at 3 and one 2 years later. But the one I saw first, I got the low gain hearing aids on. She would actually press and hold the button on them to go into a pink noise program. So the hearing aids would go shh, shh. And she said it was her beach program. And whenever she would listen to it, she could de-escalate from a meltdown. She was a level 3 autistic kid. Let me tell you know more.
Oh, my.
But conversational kid who's maybe a year behind in school. Maybe. The other one, inconsistent ASL, if any, except for at the sister's house, and inconsistent anxiety issues within the house, got the hearing aids at 5, is now echolalic and on psychotic medication.
Wow. So it really does show in everybody that you see that when it's earlier and noticeable and you're giving them the right APD diagnosis, it can really reduce the negative outcomes later on.
I think important was that she was in control of her own volume. She was in control to de-escalate when she needed to. Her mom worked with her on the meditation of using the pink noise to calm down. Everyone needs a cave. Everyone needs a safe place. Everyone needs the right cave.
Right. And the black and white thinking of saying, okay, here is this. This is prescriptive. On this podcast, we're anti the prescriptive approach, right? The prescriptive approach would say, okay, we'll do the FM unit. And the typical way is just that's it, right? And you have no control over it. But it's very important with the autistic population, especially, right, that we make things as flexible as possible so that individuals can actually have ownership. That's so critical. Even what you do with your children, like you had mentioned earlier, right? That you have ABA inspired, but it's not.
It all has to be consensual. They have to be a member of their own team.
Yes. Yes. And that's something that I feel is just so critical. And I'm so glad that you're talking about this in such an interesting way, the way that you're framing it, because I think being part of the team is the key way for any of this to work. Because the moment you tell people this is what you're going to do, okay, we'll give you this, but that's not going to work because they can't have a prescriptive way of dealing with anything. You need to make sure that you're being flexible with it. I love how people can be in control of the FM unit, and not only individuals with autism, I think other people should too. Because why should we give a child an FM unit and say, okay, you can't control the volume. You're going to have to hear whatever's coming in.
Sure. It's horrible. I listened to 2 days of a lecture where I had no control with an FM, and I would never do it again. It's a wrong thing to do. I mean, why don't we let kids into their own IEP meetings starting at age 5 or 6? They should be part of the team. They should be part of every decision about them.
Yeah, I mean, we wait until they're older, right, to include them in the IEP meetings. Typically, we don't invite them when they're younger.
I mean, I get they're a little disruptive. I get it takes a little more time, but we can still frame things so that they understand the choices that can be made for them so that they can choose them.
Right, because self-advocacy can start even when you're young. But it's so interesting that you mentioned the ASL and how people don't know this, but ASL is something that people use sometimes when they have a hearing or auditory processing issue. And I know some people say, well, I don't want to use that with my child. I don't know if it's going to work or not. I'm scared that
they even use it as like augmentative communication for autism. I know if I'm really upset, I'll go to ASL. And truthfully, it's just tactile. It's proprioceptive. It lets you actually express yourself. I might even just SimCom, talk at the same time as signing, and it helps me organize my thoughts. It helps me remember things. But people have this fear that if you learn to sign, you're not going to learn to express yourself. The reality is, the better your native language, the more likely you will function in other environments. The more likely you will learn another language. Bilingual people are inherently smarter than monolingual people, just like musicians are inherently smarter than non-musicians.
Yeah, we push that in speech and language pathology. Yeah, it's amazing when someone's bilingual.
The idea that, well, I don't want to get into the whole deafness issue of the hearing parents of deaf children and inadequate exposure to ASL, but the idea that you think you're going to cripple your kid because they're not using speech is ridiculous. The better the first language, the more you adapt your brain. You want to know more about that? Go read about Jeannie, who didn't learn language from age 2 to 12, who's now in a nursing home because of it.
Jeannie, who's in a nursing home.
But at age 2, who is neurotypical kid. Age 2, the parents strapped her to a potty seat and left her in a room by herself until she was 12.
Oh, my goodness. Oh, until she was 12, right?
Mm-hmm.
Yeah,
and then
I didn't know the name was Jeannie.
Chomsky and all them, they found her. And I don't know if Chomsky was directly involved, but it had to do with critical language age back in the 70s. They took this kid and tried to teach her language, even though she had it for the first 2 years. Could not stick. It was like, gone. So she's like functionally, I don't know what you want to call it, cognitively impaired for the rest of her life.
Because of the limited language exposure, even if you're exposed to it, if you lose it because of something that comes your way, such as auditory processing, it sounds like you could lose it for good, right? So that's why it's important to treat it.
Deaf kids who have hearing parents that don't use good ASL with them because they can't learn it well enough themselves, read at a 3rd to 4th grade reading level on average finishing high school, and do about the same getting out of college. It's because they didn't have a strong enough first language in the first place, which is why I support kids with ASL.
Yeah, and it's so interesting that you actually thought you found your tribe, but obviously they weren't your tribe. But in ASL, because you were dealing with this auditory processing, were you ahead of your time in a sense? Because you then would later on become an audiologist specializing in ASL, and that is something that helped you, it sounds like. You lived through it. ASL supported you, right?
I don't know. I mean, ASL and the deaf community never really supported me. They mostly bullied me.
Right,
but
the community.
acute speech community, on the other hand, did support me quite a bit, which is the phonetics, So I am doing everything I say.
Yeah.
And that's
while
a
you were
great
speaking.
dyslexia, and it's a great way to teach kids to have language if you don't have the time to learn ASL. I don't know. I would say I found the language of my heart, but I really can't tolerate dealing with learned helplessness and purity politics.
Yeah, which is why, like you said, every individual needs to be a member of their own treatment team, because ultimately, like we started off where you were explaining everyone's in silo. We need to start collaborating more. The fact that you're the only audiologist that's been on here so far is crazy. Why are our fields not more allied and aligned where we are interacting more? We're sister fields. And so I think I know what your vision for the future is. I mean, but I would love for you to share it with everybody, because it sounds like you have a lot of ideas, a lot of really good ideas to change the status quo for much of our teens and tweens and young adults, because you don't want them to end up in situations that are really avoidable.
I believe that audiology changes the field, or the hearing aid dispensing community will overtake them with people that have training in more flexible backgrounds. And if we tie everything into hearing aid sales as our primary way of making money and try to keep people from having access to them, there are other people who can make better products for less.
Mm-hmm.
Honestly, I think we're going to start seeing over-the-counter products that are entertainment-based only, officially, like Forebrain, that we're going to see taking over the hearing aid industry. And I think we're going to see more and more dispensers. Instead of taking 8 years of school, it'll be 3 to 6 months.
Yeah, I think that's with a lot of jobs, yeah.
And I think that we can choose to be involved and make sure that the direction of the field is ethical and standards-based, or we can keep maintaining our silos.
Right. So let's put an end to the silos. For anybody listening, I'm ready to get out of my silo if I'm in one. I mean, I try to collaborate so much, but sometimes it's hard. I think that in general, change occurs sometimes in a small way, right? Like even if you're starting to, but unfortunately, more people need to start getting out of their silos too, so that we could all collaborate together. You heard it here. Dr. Rae, thank you so much for sharing all this information, from auditory processing to how it impacts the social communication aspect, but it also impacts our autistic teens and tweens. And thank you for being so vulnerable and so honest and sharing your personal experiences, your children's experiences. Every time you do that, I feel like you're really tapping into other people who are going through difficult times right now, that are trying to fit in, that are trying to get through their next social event. And I think everybody who's listening, who's struggling, can hear it from Dr. Rae. She lived through it. She went through it, and she's still trying to find her tribe, but she's letting them find her. But always, it sounds like, always self-advocate, right? Always make sure that you're speaking up for what you need. Don't let other people tell you what you need, because you're the top team member, right, on your own team of treatment. So, Dr. Rae, where can everybody find you and your projects? All your amazing work that you're doing to build advocacy and support everybody.
So I'm a big believer in the use of AI as an accommodation for neurodivergence, as long as it's ethically used. I'm not a big art fan with it, but for the purpose of organization and writing, I think it's incredibly helpful for someone who has memory and organization issues. I do talk about that quite a bit. I talk about a lot of things. I have a blog. It has about 70 some articles. You can find it at drraestout.com/blog, BLOG. And that gets to most of the spots that I am. I'm going to be talking in Chattanooga, Tennessee, September 5th, about sound sensitivities and autism. I'll be meeting whoever would like to run into me at the Drury Hotel on the 4th, which is in Chattanooga, Tennessee. And I'm getting very involved with the Learning RX cognitive training group in virtual auditory training and virtual cognitive training. So I've been doing a lot with those areas. I have a couple of Facebook groups. One is an APD Facebook group of about 13,000. I also have one on weight loss, fitness, and pathological demand avoidance / persistent demand for autonomy. And I have the neurodivergent and disabled yellow pages, the review group. So, and I am very involved with AI music on Suno. I'm very much enjoying that.
Wow. Okay. So you have so many things going on. I can't wait to see where everything goes, because you are such a nice, loud voice that's honest and transparent with everyone. Thank you so much for spending your Friday almost evening with me during this nice summer months. Thank you for being here.
Thank you.